So thank you.
All right. So I guess we just get right into it, huh?
Sounds great to me.
All right, perfect. So Stuart, tell me a little bit about yourself and why you're interested in our job here at South Metro.
So a little bit about myself. I was originally born in Salem, Massachusetts, and when I was 8, moved down to the Fredericksburg, Virginia area, so kind of halfway between DC and Richmond. A little bit involved in a little bit of everything, honestly. I did club swim through college. I also did high school varsity swim. Did a little bit of JROTC within high school as well. Then I pursued my athletic training bachelor's at Longwood University. During that, I was also involved with a volunteer department at home, Stafford County Fire and Rescue. And under Stafford, I was with Brook Volunteer Fire Department, whereas I served as the rescue chief. During school, I also worked part-time with Prince Edward Rescue, and where I was involved in the special ops group of the county. So we did a little bit of the technical rescue, vehicle extrication work there. So that kept me pretty busy during school. It was called out in the middle of the nights. We were a little bit rural of an area, so we only had one truck at night. So it got pretty busy sometimes where I would get called in. Overall, loved it. It kind of gave me that ability to serve not only just the community, but it allowed me to become part of the community. It was pretty interesting being part of a rural area in which I would go out and see people that I ran calls with or that I ran them as patients. A little awkward at times, but pretty interesting to see how small a community it actually really was.
Yeah, cool, man. Well, so it seems like you understand like the fire world, right? And that response time. So what makes you think you'd be a good fit for a wellness assistant?
I think in a way I have a little bit of insider knowledge on it. I only do the EMS side of things. However, with Stafford, we're a combination department, both combination volunteer and career, but we're a combination that we do fire and rescue. So I've been within that service and within that world for about 4 years. So I understand the physical as well as the mental and emotional demands that are required by that job. So I've had some friends that have had injuries. I've experienced minor injuries myself, so I understand the taxation the taxation of the job on the body. So I think with that knowledge there, apply that with the knowledge of an athletic trainer, I think they go hand in hand to make a pretty good combination.
Yeah, for sure. Cool. So what skills or attributes do you think you'd bring to South Metro?
I think 2 of the attributes that I would say would make me an asset would be that of integrity as well as adaptability. Start with adaptability. I think within every situation you're in, it's very important to be able to go with the flow, but not only that, but adapt to the situation to be able to deploy your skills in the best appropriate manner. I think integrity is an all-encompassing skill that when applied to everything, it allows you to stay on that yellow brick road. I say this with a little bit of a smile. My father's with the Marshal Service, in which their slogan is justice, integrity, service. And the part that I say with a smile is I think my first words might have been integrity. Remember coming home from school and I feel like that word was thrown as soon as you open the door. What's the family word? It's integrity. So with that, it's an all-encompassing skill that when applied to organization, your leadership skills, or communication, it allows you to fulfill that role to a 100% capacity.
Cool. And then how do you think being adaptable helps like working with firefighters or just in the fire service on the rehab side or the wellness side?
So with that being the adaptability applies in that within at least my schooling thus far, you don't get that typical tactical athlete or that first responder athlete that you're working with. So that ability of trying to relate our general knowledge of athletic trainers within a sports setting and now applying that to an occupational setting within first responders, it is a different set of injuries, but it makes sense that there's injuries with it. So now being able to adapt my knowledge of an athletic trainer within sports settings and apply that to a first responder population, that alone is going to be huge within itself. But it's the importance of me personally being able to adapt myself easily and fast to be able to do such.
Cool. What's your biggest strength?
I would say my biggest strength is my personal drive. I feel like I am constantly striving to be better than what I am right now. whether that's through reading articles to try to stay up to date with evidence-based practice, or just communicating with other peers, or communicating with those that are higher than me, whether it's education-wise, certification-wise, or others. It's always pushing myself to be better and learn something from everyone in every environment or situation that I'm in.
Cool. And what about your biggest weakness?
Say one of my biggest weakness, or at least something that I'm working on better or more so, is approaching situations with tact. Every situation is very unique in that the ability to approach it with tact and navigate it appropriately changes. And one's ability to do such allows them to navigate all situations appropriately. I might interact with a patient differently than I might with a younger patient versus a firefighter for 10, 20 years. It's one of the salty dogs. However, approaching it with tact and being able to communicate with them appropriately is going to be a huge aspect within patient care alone. And that's something that I'm actively working on.
Cool. Awesome. So when we think about like you hit on it, right? They're tactical athletes. They're not your football player, your basketball player. They're not 18 to 22 years old in that college type setting. What do you think you bring, or what do you think your strength is as a clinician that helps you work with these firefighters that might be the salty dog, as you say, at the end of their career, versus that 18 to 22-year-old athlete?
I think the level of professionalism needs to remain constant. These are not your typical athletes that are just going to kind of roll with the flow and do whatever you tell them because you're the athletic trainer of the school. A lot of these individuals are going to be EMTs, advanced EMTs, paramedics, whatnot. They're going to have somewhat of a medical background, or at least be involved in the medical field. They might question a little bit more. They might ask that question why, which some clinicians may not appreciate or like being questioned. However, I feel that that's important, especially as a patient, or if I were to be a patient, I would ask that question. So I think being able to explain that reasoning why will not only give me that credibility, but also that trust and just that rapport with the patient or that firefighter.
So describe for me like a situation in your let's go with your athletic training realm, but then also give me one in like your EMT realm of where you kind of you did all the right things and it still didn't come out the way you wanted it to do, whether that's a rehab or an evaluation or what it might be. What did that situation look like and how did you deal with it?
So one within the athletic training world or realm, so to say, is I had an athlete that was coming back from a concussion. I followed the protocol that the doctor gave us, followed all the steps. It was a very nice, well laid out 10-week program, all the way from integration into the classroom to integration into sports to full participation. I followed it to a T. That was a semester ago. However, this semester, or approximately 6 months later, that patient is still suffering from concussion-like symptoms. So it's that awkward situation of you followed what was given to you by a doctor, you followed what was supposed to be the gold standard, so to say. And unfortunately, we told that patient, yes, this is going to work. And then we're 6 months post concussion and post integration of the protocol, and they're still having concussion-like symptoms. It's one of those things where we just have to reassure the patient that we're doing things adequately and following standards, but it's a little bit tough at the same time.
Yeah, those long haul concussions are not easy at all to deal with. What about like in the EMT world or in the fire world? Has there been a situation that didn't go quite like you expected?
So I have two come to mind. One of the more notable ones or more recent ones is this past Tuesday, I was called out for an extrication on a vehicle. And it was an odd one in that the vehicle was turned onto its side and there was heavy entrapment, heavy intrusion. It was very hard to see the patient itself. So we ended up having to remove the roof while the vehicle was on its side and then remove the door. Well, that opened up a new problem that we found. The patient's steering wheel was actually in his lap. His knees were trapped and his ankles were trapped. This created a multifold situation that we had to each time clearly communicate, problem solve, and then implement the appropriate procedure. So while everything was able to be done, it was just one of those things where we thought we had the right plan, and then we opened up and we found more things to follow. The second one that comes to mind, or a couple within that second example, would be cardiac arrest calls. It's one of those situations where we may be able to deploy every single skill appropriately. However, Unfortunately, time is not on our side most of the times. So it's one of those things that I debrief after every time with my crew or whoever's working that call, and we discuss, all right, what do we do good? What do we do, or what can we improve on? So we always use those as learning examples. Unfortunately, it doesn't always go successful though.
Yep, for sure. How long are you guys on that extrication for?
Unfortunately, I'm not proud of it, but it was 56 minutes to get the patient out. It was a long one. It was impressive,
Yeah,
to say the least.
yeah, that's not bad though for the amount of time that
And it's
that.
a very rural department, so it was only myself and my partner on the heavy rescue, and nobody else had
Oh,
extrication experience. So it was it was a bit tough.
that yeah, you guys did pretty good. Then I'd say, I mean, we have a heavy rescue, right? That would probably go to that, and then we have a tower. Those guys have all extrication equipment, so we probably have 30 people there. So that's pretty good for just you, your partner.
I was thinking back home, I was like, all right, who else are we calling? And then I realized once we got on scene, I parked. And I was like, ooh, there's nobody else to call. We're it. I mean, next
Yeah,
team might be Richmond, but they're going to be a while.
yeah, right. Oh, nice. So, obviously COVID-19 has changed the world, right? Like changed everything we've done. It's made this Zoom way more possible, even though for some reason I didn't have my work computer. So that's why I was a little late. We only have Teams, so I had to figure that out. But so everything all over the world has drastically changed, right? Describe how you've been able to cope and manage these times of uncertainty, adversity, and constant change through your senior year of college, right?
Junior year, sir.
Junior year, sorry.
No, so like you said, it's that unknown. It's not knowing what's going to be next week or even from 2 months from now. Very fortunate enough to be involved in the field where I'm able to have the COVID vaccine, so that brings a little bit of certainty or at least some comfortability. However, even dealing with this on a volunteer level, I feel every week I receive a new email from the Virginia Department of Health that we're changing standards. So now it's very hard for me to, as the rescue chief, to then turn around and have to tell my 50 people, hey, unfortunately, we're changing everything that you thought was right. We're changing it. So that goes back to those traits, adaptability. One of those things where you just have to process the information, collect all of it, and then implement that plan. I do my best to be adaptable in all situations, that I try not to get too stressed out when things do change. It's that important thing to remain cool, calm, and collected and just implement the appropriate procedure or the appropriate plan next. I think within the athletic training field, it's changed numerous amount of things. And I say this jokingly, and some of those things you're like, well, why weren't we doing this all along? Even with the ambulances, why were we not cleaning them as thoroughly as we are now? So I think a lot of things are here to stay. And I think we've learned a lot as healthcare providers and healthcare professionals, that many of them are bettering the healthcare community or the healthcare in general.
Cool. What would you say when somebody walks through the door, right? And you think of like, this is my philosophy of taking care of them, right? Like if I had to say like, no, regardless the injury, like these are going to be my goals. Like, what would you say your philosophy of care for a firefighter would be?
I think the number one thing would be maintaining them as a healthy person. So whether it pertains to healthy in the occupation or healthy at home or healthy within the mental status, my goal is to make them as healthy as they possibly can be. I'm also going to include their patient or their values. So what do they want? Why are they coming to me for help? As well as education. I think it's very important to be a patient advocate, to include educating the patient on everything. I know, at least from a first responder standpoint, mental health is one of those things that not many people talk about. However, I'm finding, at least within my personal experiences, as well as my experiences being responsible as a rescue chief for other members, it's important to take care of your mental health before you take care of anything else. One of those little philosophies of you can't take care of others unless you take care of yourself. So as an athletic trainer for that first responder population, I want to be able to help them take care of other people in the long run. But that starts with them first.
Awesome. What questions do you have for me?
One question would be, how would you say working with a first responder population is completely different, or what do you think is the most unique aspect of dealing with first responders opposed to that traditional sports or athletic population?
Yeah, for sure. So my history was in college athletics, right? So dealing with guys that it's fun. They're to get a scholarship, right? In Division I level, you have guys of pro dream, but at the end of the day, it's not the job that puts food on the table for their 3 kids and their wife, right? So the biggest difference for me is when I'm making a decision about what I'm doing for a guy, you got to think like his family depends on him to have his career. He depends on his career for his retirement. He depends on his career for his livelihood. And in the first responder world, it's their identity too. Like that's one of the biggest challenges when guys get towards the end of their career is understanding like, hey, like, like it's getting time, right? Like, we always joke when we go to the Redmond conference, it's like you can know every firefighter because they got a t-shirt or a mustache, right? It's a huge part of their identity. So understanding that an injury that might be something super minor, like a meniscus tear, right? Or something like to them could be viewed as a career ender, right? And so even though we look at it, right, we're like, dude, it's fine. It's not that big a deal. Like you're not even going to miss a set. But to them, when they're walking in to see us, they have, especially at the end of their career, they have ideas that this is it. I'm done. I'm not going back to work. Like my pension's done. My kids are going to go hungry. Right? Like, so that's probably the biggest difference, right? The second difference is just the age. At the end of the day, like orthopedic issues are orthopedic issues. But a 55-year-old that's been in the fire service for 25 years responds a lot differently and heals a lot differently and tracks a lot differently than an 18-year-old with a very similar injury. So understanding that those timelines that you expect to hit as you're recovering in rehab, they might take a little bit longer with them, and educating that firefighter that's okay, right? That's normal. Like our goal is to get you feeling better. And if we have to take this progression a little bit slower, it's fine, because if we push you too quick early, there could be issues. And so we see that a lot. It's like, well, how long did it take you when you were in Arizona? How long did it take you back to that from that injury? It's like, well, you're comparing apples and oranges here, right? Like, but you can't tell them that. You got to kind of gingerly walk around the fact that it's a little bit different.
No, that's very good insight. I mean, I don't know if I really made that full connection that, like you mentioned, that game changer, that career ender. They have a little bit more weighing on them than we might think or compare to that of an athlete. So it's appreciate it. Thank you.
Yep. Yeah, for sure. And then to go with that, like you see it, it's everything's an emergency, right? So when the tones go off and you're leaving, it's an emergency, right? And there's a sense of urgency that goes with that. And it's up and down, right? So when these injuries happen, it's often they come in and there's a huge sense of urgency for something that might not need that sense of urgency. But that's the go-to they know, right? It's all in all the time. Like the fire service, except for out there is like where we're at, we're great at throwing resources and people very quickly at problems, right? The more resources and the more people they get on scene,
right,
the quicker that issue usually resolves. But the downside of that is a small garage fire all of a sudden has 50 people on scene and a tower and 5 engines, and you're going, oh my gosh, and it's like was out before half of them got there. So just understanding those dynamics and those and the type of person that you're dealing with helps you understand at the end of the day, like where they're coming from, and then to take the best care of them and help get them to the place they need to be.
Understand. Thank you.
Yeah. Only one question.
I think you answered a lot more than what I was expecting out of one question. So you threw a lot into there, and I appreciate it. You gave me insight to a lot of different angles.
Yeah, for sure, man. So if you think of any, let me know. That's all I got for you. I think I hit everything, so that needed to know.
And I actually have one question, just thinking about it now. Did you have any experience with first responders, firefighter, EMS, or any of that nature before coming into your role as an athletic trainer with this population?
Yep. Short answer is no. I had no first responder. My first job was at West Point. So I worked there for 2 years with the cadet athletes. So saw a little bit of the military side of things, right? And how athletic trainers could be used in that setting in the military. And so that's kind of what sparked my interest to kind of start looking at, I initially started looking at military type jobs. And then just kind of dumb luck. A person I worked with knew a person at South Metro and they were hiring, and she's like, you might be interested in this and check it out. And so the only history I had with first responders was my grandpa was a firefighter. So I knew a little bit, but he retired in 1986. So the year I was born, he left the fire service. So I didn't know a ton about the fire service. I knew about what he had told me, right? And I knew a little bit about it. But I have just learned a ton, and those guys have really taken me and our wellness department under the wing, right? And been like, hey, this is what it's like to be a firefighter. Before COVID, all of our staff was going to go do a 48-hour ride along. Our guys work 4896s, and but then COVID hit and we weren't able to do that. So that's something we'll hopefully be able to do soon. But no, to answer your question briefly, no. But at the end of the day, like we talked about, orthopedic injuries are orthopedic injuries. Like athletes are athletes. Movement patterns are movement patterns. So like the information relays across nicely. Just you have to, sometimes it's not quite what you're used to. It's just a little bit different setting.
And so we mentioned that of the salty dogs earlier. More so that aspect that I've seen with the older generation of firefighters is, well, this is the way we've always done things. Why change things now? I mean, the common phrase of firefighters hate two things: the way things are and change. So with your wellness department, that's obviously, from at least my knowledge and research behind athletic trainers within this population, it's a very revolutionary kind of field. Not many departments have this wellness department aspect to it. Would you say that it's been integrated into South Metro Fire fairly well, and that the firefighters are open to this sort of care?
Yeah, they 100% are. So I think to kind of fully answer that question, you have to understand how we got to where we are with our wellness department. So back in 2014, we were doing the incumbent physical testing. So I don't know if you're not aware of that, like the IPAT testing, which is basically like a little bit of a modified combat challenge type test.
Okay. Yep, I got you there.
So we were doing that test, and that was our yearly physical fitness assessment, right? So I think they had like 7 minutes to complete it. The battalion chief's goal was to get everybody through in a day. Didn't pay attention to any environmental concerns or anything like that, heat, cold, whatever. So one summer they were doing it. We had an incredibly fit member complete the IPAT, go back to the station, and then go into cardiac arrest. Basically, by like normal standards, I don't know if he would have lived, right? They actually took him back to the cath lab while he was in cardiac arrest and were able to save him. So that happened. Another day, we had a guy have a hypertensive crisis. And then the following day, somebody coming off shift went and completed it and had a MI as well. So we had 3 significant illnesses in that 24-hour period. So at that point, they ceased that IPAT as the physical fitness assessment. The union and the fire chief came together and said, what are we going to do? The fire chief wanted a punitive yearly fitness test. And the local was frustrated with the yearly physical process because they're getting 2 hours of overtime and it was taking 6 to 7 hours to complete that. And they're also frustrated with the current workman's comp situation. They're basically, things were just getting drug out for way too long and guys weren't able to get care. So looking at those things together, basically the local came and said, we want all-encompassing wellness department, and the fire chief said, all right, I want a punitive physical fitness test that makes sense, that's proven by science. And they settled on the VO2 max. So we do a punitive VO2 max every year with our members. But we also have an all-encompassing wellness program that is really, we have medical surveillance, we have PAs, we have a doc that's in 1 day a week, we have 3 athletic trainers. So it's started with 1 athletic trainer. So one of the union guys interviewed multiple people. He interviewed physical therapists, athletic trainers, exercise physiologists, and the athletic trainers came in and said, sounds like you have a team of 300 guys that need care, and that's what I do every day. Like I'm used to, I work football, like that's what we do. Like we evaluate them, we refer them, we get them to the doc quick, we get them the imaging they need, and if they need rehab versus surgery, we make those determinations quickly versus like let it linger on while people are sitting there offline. So to answer your question, yes, they bought in because it took the local along with the administration to build the program. It wasn't just the chief saying, this is what we're doing, right? And feeding that down. It wasn't the local saying, this is what we need, right? It was them coming together to build that program. So that's, I think, part of the reason we've had such great success is because of the collaboration that it took to build the program.
I think that's huge. It's great to hear that both sides have buy-in into it. Allows you to be able to fulfill that role tremendously.
Yep. Yeah. No, it's pretty good. Pretty lucky to be there.
Seems like it. That's all the questions that I have that come to mind currently. Appreciate this time to be able to ask these questions.
Yeah, no problem. Those are good questions. So I think I usually just be like, I'm done with you. We're good. But do you want to end the recording and then we can chat about a
Yes.
couple of things
I mean, first time recording these things, so let me make sure I do.